So there's really been a renaissance in research around PBC over the last few years, and that is great news for PBC patients, because the more research is going on, the more we learn about the illness, and the more patients then have options, choices, and things that will help them in the long run. Some of this work started over 20 years ago and resulted in the first drug that was ever developed for the treatment of PBC, ursodiol or UDCA. More recently, and in a more modern era and a more modern area of research, obeticholic acid or Ocaliva was developed and is indicated for the treatment of PBC in patients who are not having a complete response to ursodiol or who are not tolerating it very well. For Ocaliva, there's still ongoing research on Ocaliva and PBC. Our initial research focused on how does Ocaliva do at decreasing alkaline phosphatase. And that's a very important piece of information because it's well known that alkaline phosphatase tracks very well and helps to predict liver damage. So if that alkaline phosphatase can come down, it's very predictive of the long-term outcomes for the liver. And that's important for patients to know as well. It's something they want to keep track of with their doctors. The FDA and other regulatory authorities approved Ocaliva on the basis of seeing the alkaline phosphatase come down, but have asked us to do additional research, which is currently underway. There's a current study that follows patients with PBC, not only looking at alkaline phosphatase, but looking at their ultimate health outcomes related to their liver. And the hope is that treatment will result in a difference between these very, very important outcomes, things like liver failure and the need for liver transplant. Time will tell, but that kind of research is important for patients everywhere. There are other drugs being also developed for the treatment of PBC, and other pharmaceutical companies are looking at these medicines and doing research. And it's very important that that research is done so that we know if the medicine really does what it should do and if its safety is what patients would want it to be as well.